Thank you for having me. It's great to be a part of the Business and Tech Conference. I'm Dr. Cowan. I'm the founder and lead practitioner at Phenom High Performance Medicine, and we help people maximize their health and performance to take them to new heights. We are a team of board-certified naturopathic doctors and functional medicine practitioners, and our focus is on high performance. The work that we do couldn't be a better fit with the theme of this conference, which is drive, racing, speed, and high performance. For the past 10 years, we've been working with some of the most elite performers in the world. Top NHL players, UFC champions, Olympic gold medalists, elite executives, entrepreneurs, and companies. And the biggest thing we've realized is that most people have no idea how good their body is designed to feel and perform. The picture you see of the F1 car represents how good your body is supposed to feel and perform. The picture of the broken down rickshaw is how many people actually feel. And for many others, they think they're feeling like the F1 car, but they're actually functioning like the rickshaw. And that's the most important part, because as human beings, we get used to a certain level of functioning and it quickly becomes our new normal. I'm excited to share with you the things that we do with our high performers to help them excel to new heights. My first patients were pro athletes. I had 2 to 3 months to optimize them and take them to new heights in their performance. So I quickly had to figure out how we would adjust our methods to optimize people in a short duration for big impact results. The agent that I worked with had sent me a few of his top athletes as a trial, sent me a few more, and within a couple of years I had their whole roster of athletes that we were working with. So this is sort of the birth of our methods, and what I'm going to be sharing with you guys today is how we developed everything to really optimize people really quickly and really efficiently in the ways that really matter. So the key thing is that peak performance on the inside equals peak performance on the outside. So with my medical knowledge and background in sports medicine and training in functional medicine, I knew that we had to optimize certain body systems that would give us a big return on our efforts. So those 3 systems are the base of our Phenom method that we practice with. So the 3 key body systems that we need to focus on to optimize performance quickly are the digestive system, the hormone system, and the detox system. So we're going to go into a tiny bit of detail so you understand what those systems are and what the impact of them is, and then we'll talk about how to optimize that, and you guys will have strategies that you can start using today to start improving yourself. The digestive system is the first system that we'll talk about. So with that, we're thinking about nutrient absorption. So obviously the type of food you're putting in, the type of nutrition that you're including in your daily routine is very important, but the absorption of those nutrients is key. We always say to our patients that what you eat is important, but what you absorb is even more important. The other thing is the gut-brain connection. And this is an emerging field in medicine over the past 15 years, whereas the gut is now seen as the second brain. So the gut and brain are directly connected, communicating with each other back and forth instantaneously all day long. More than any 2 other organ systems, they are connected. So when we're thinking about optimizing your digestive health and your gut health, what we're also doing is optimizing your brain function. So when you think about digestive system, think about mood, motivation, your ability to comprehend and focus quickly on different things. So the digestive system also produces 80% of your neurotransmitters, which are your feel-good brain chemicals. So really critical for peak performance, both mentally and physically. The other component of the digestive system is the immune connection. So about 70% of your immune system is based in your gut. So when you're talking about resilience and being able to power through and be a peak performer in your field, we want to make sure your gut is optimized so your immune system is optimized as well. The second system, which is the hormone system, for this system, I want you to think about peak daily energy, peak performance, deep sleep, recovery. Those are all driven by what your functional hormones are doing, and your circadian rhythm is a result of what your functional hormones are doing. The other component for your hormones is metabolism, how well you can lose body fat, how well you can build lean muscle mass. Those things are all critical. The other component of your hormone system is your stress hormones, so how much resilience you have. A big part of being a peak performer is consistency of peak performance. So the amount of resilience you have, the amount of buffer you have before burning out, it is really critical to be at your best. The third system is the detox system. So with that, you want to be thinking of liver function. So your liver is a giant filter that helps you to filter out the bad stuff from your system and retain all the good things that you want, all the good nutrients, all the things that are going to help fuel your performance. The liver also is in control of recycling those big hormones we talked about in the hormone system. So female hormones, male hormones are all connected to what's happening with the liver. So we really want to optimize those three systems to drive peak performance. They all work together. The whole body is integrated. So you want to optimize each of those three systems and having them work together to really give you a foundation for peak performance on a consistent basis. So we think of the people that we work with as high performance machines. So we want to assess how they're currently functioning and then quickly optimize things to maximize their potential. So some of the top signs we're thinking of with each system so that you can identify maybe what system is potentially not optimized for you. So with the hormone system, we talked about peak daily energy and peak sleep and recovery. So some of the signs and symptoms you're looking at with the hormone system are hard to get out of bed in the morning. So that's one of the main signs. So cortisol impacts your ability to wake up and have alertness to start the day. Energy crash in the afternoon is another sort of sign that we're looking for. Trouble falling asleep, light sleeping, or waking between 2 and 5 a.m. are other signs that there might be issues with the functional hormone system. Difficulty losing the body fat, difficulty handling stress, feeling that you're overwhelmed easily, irritated easily, go into anger, anxiousness, or depression, or low mood. Those are some of the things we're looking for. And some of the things that you can be looking for to figure out if your hormone system may not be optimized for yourself. The digestive system, there are some key signs we're looking for there as well. So definitely things like bloating, fatigue after meals, constipation, loose stools, trouble losing weight, water retention. And then on the mental side, remember the gut-brain connection. So brain fog, trouble focusing, low motivation. Those are some of the things you want to be thinking about with the digestive system if it's not working optimally. And the last system, which is the liver detox system. So skin issues, things that are happening sort of externally are a reflection of what's happening internally. So remember, your liver is a filter to get rid of things. So it'll also clear things out through the skin. So skin issues, eczema, psoriasis, things like that we're looking for as signs the liver may not be working optimally. Also metabolism issues. So if people have a stuck metabolism or sluggish metabolism, that can be a sign of some detox system issues. And then male and female hormone issues, which are also quite common. So female hormone menstrual cycle issues, really bad PMS symptoms, or on the male side, issues with testosterone or some of the other male hormones, DHEA, for example. So those are some of the top signs to be looking at in terms of knowing which system is out of balance for you. So 3 big impact things you can start doing right away to start optimizing yourself. I've picked sort of the 3 biggest impact things. There's so many things that you can do and that will assess and optimize for people, but the 3 biggest ones that you can start doing right now are number 1, so first morning sunlight. A lot of people don't know the connection between sunlight and hormones and sunlight and circadian rhythm, but first morning sunlight is actually the cue to kickstart your brain and body for the day. So we talked about functional hormones. So that first morning sunlight hits your eyes, triggers a release in your brain to send out cortisol into your bloodstream, which wakes up your brain and body for the day. And you sort of ride that energy wave throughout the day. So you want to optimize that to get your circadian rhythm synchronized and get everything operating the way it should. 80% of your genes are coded based on a proper circadian rhythm. So sun up and sun down, your whole body kind of works off that rhythm. So if we want to tap into the levels of a peak performer, we want to make sure you're getting that cue first thing in the morning. So 10 to 15 minutes of first morning sunlight is ideal. Depending on your location and climate where you are, it may not be possible to get out and get actual sunlight. So you can use an artificial light, like an SAD light. You just need about 10,000 lux of light. Lux of light is the unit. You need about 10,000 lux of light to replicate first morning sunlight. And at the other end of the spectrum, you want to get rid of as much light as you can at the end of the day. You don't want to be signaling your brain to be awake when you're trying to sleep. So you want cortisol to be peaking throughout the day to drive peak energy, and you want it to fall at night to allow your sleep hormones to kick in and get all the restorative and regenerative benefits of your sleep. So this is why people talk about blue light and getting rid of blue light and getting the screens away from your face before bed, because blue light signals your brain to release cortisol, which is the opposite effect of what we want to have at night. So about 2 hours before bed, you want to get rid of the screens. Alternatively, you can use blue light blocking glasses or have different filters on your screens and devices to block the blue light out of your system, so you're not getting that waking signal at night. So the second thing you can do to really make a big return and big impact on how you're feeling and functioning is take a period of 10 days and pull out all the gluten, dairy, and eggs from your diet. And the reason why I've selected those three, just based on some of the blood testing we do and working with thousands of patients, those particular foods seem to cause people a lot of issues. Those are very common food sensitivities that people will often have. So take a period of 10 days, take them out of your diet completely. You want to go to 0 with them, not have any at all, because you want to clear out any antibodies from those foods you do have in your system. And then you can reintroduce them one at a time and just see how you feel. So if you're noticing that you've pulled out all those foods, you put back in one of those foods, you're noticing fatigue or headaches or joint pain, change in bowel movements, bloating, you just feel off, then that's a bit of a sign for you to know that this food may not be working for you. It may not be working the best for your system, which is very common. So then you'd want to keep it out of your diet and only have it, once every 3 days, so you're not accumulating those antibodies in your system and making everything sluggish and harder to function. So those 3 foods are the biggest ones to pull out. So the third big impact thing that I want you to try is something that we call the Phenom 100 Food Challenge. So this is trying to eat 100 different types of fruit and vegetables over the course of 1 month generally, which equals about 3 to 4 different foods per day. So, and you want to try to have a wide variety of fruit and vegetables, not picking 8 types of tomato or 5 different types of apple or whatever it may be. You want to expand your horizons. The reason being, the types of fiber in those different fruit and vegetables feed your good bacteria, your good gut bacteria. So the more diverse range you can have, the more diverse range of gut bacteria you will have, which is massive for gut health. Some of the tribes in Africa, for example, will have 70 to 80 grams of fiber a day of all varying sorts, and they have some of the most diverse gut bacteria of any population. So something to try to incorporate in your routine over the course of 30 days, or if you can do it faster, that's a great way to do it as well. It just depends on how quickly you can do it. So altogether, these 3 strategies are really big impact things. So hopefully you guys learned some things today and can apply some of these strategies right away and incorporate them in your routine. And sort of a final thought is that peak health and peak performance, it really is your greatest competitive advantage. So hopefully you learned a few things today, and now you have some strategies that you can apply right away to start optimizing yourself. And hope you enjoy the rest of CDW's BTEX conference.